Hello, my name is Dr. Harpinder Shivchenko from Smiles by the Sea Family Dentistry in Hampton, New Hampshire, and I'm here to answer some questions regarding dental x-rays. One of the very common questions, that simple question that comes across is that what is a dental x-ray? Um, like a regular x-ray, dental x-ray is an x-ray of your tooth and also the bone that supports your tooth. So when we are taking a dental x-ray, it could be that we are taking a single x-ray looking through the bone and the internal structure of the tooth, or we could also, dental x-ray is also one kind of x-ray, is a bigger x-ray, we call it. It goes around your face, where we are looking at your joint, which is called TMJ, temporomandibular joint. I know it's a big term. So it's a jaw joint that we look at, which actually shows us all of your teeth. It's very typically done in younger kids or when we are looking for wisdom teeth. So dental x-ray is a x-ray of your tooth structure and also your bone that surrounds the tooth structure. Another question that comes across is, when do dentists take x-rays? So there are different scenarios where the dentist will take x-rays. Let's start from the very first one, that if you're establishing yourself as a new patient to a dental office, we will take your full mouth x-rays. We're going to evaluate your whole mouth, so we're going to be taking x-rays at that time. Second scenario would be if you have an emergency, we will take the x-ray of that tooth or that area of your mouth. Other circumstances, if somebody in kids, if they're having pain in their wisdom teeth, we will take x-ray for the wisdom teeth to evaluate them. Other x-rays which are common, if you're going for your maintenance visit, we call them checkup x-rays, that are typically taken when you go for your regular maintenance visits to make sure that there's no cavities going on, there's nothing going on with your bone, around your root of the tooth. So those are called checkup x-rays. So those are some of the common types of x-rays that a patient will get as they are seeing their dentist. Another question I do get asked is, what is the purpose of dental x-ray? Actually, a great question. So purpose of the dental x-ray is for us as your dentist to be able to look underneath what is going on in the tooth underneath the bone. So our tooth, which we are seeing, actually is one part of the tooth which is visible in your mouth, that we as clinicians, providers, we can see, and you can see as well too. But part of the tooth resides in the dental bone, our jawbone. So, and it is covered by the gum. So whatever is going underneath there, we clinically with our eyes, we cannot see like that. So to make sure there's no infection, that you're not losing your bone, there's no other problems going on, we take dental x-ray to evaluate that part of the tooth, which is very, very important part of the tooth. That is actually what is holding your tooth, which we are seeing on the top with our eyes, inside our jawbone. So we are looking at what is the condition of your jawbone and what is the condition of the nerve inside the tooth. How are your roots of the tooth looking like? So that is the reason and purpose why we take x-ray, to make sure there's nothing going on, there's no disease, there's no conditions which could lead to other problems. We use the x-ray to evaluate that. Another question I do get asked is, what are different types of dental x-rays and why are they used? So as we were talking a little bit before, so let's go from the beginning. The very first x-ray, if you're establishing yourself as a new patient, would be what we call as a full mouth x-rays, full set of x-rays, where we are taking individual x-rays of each tooth or a couple of the teeth together to evaluate again your root of the tooth, the bone of the tooth, and the surrounding structures of the tooth. So that is called full mouth series. It involves individual x-rays taken of individual teeth, and also there are smaller x-rays which show us in between of the teeth more clearly. We call them bite-wing x-rays. So that is a whole one package that we take when you're establishing yourself as a new patient. Then also could be individual x-rays. Let's say somebody has a dental emergency, broke a tooth, somebody's having a pain, there's a swelling in the mouth. So we might take, depending on, once we do the examination, if there's one tooth involved, two teeth involved, we can take the very detailed x-ray of that part of the mouth, that tooth or couple of the teeth. So those are individual x-rays. And then the third kind of x-rays are, as I mentioned before, that we do at the checkups, are called bite-wing x-rays, which are x-rays which show the half of the tooth, and basically they are used to diagnose any cavities in between the teeth. So those x-rays, we take them as a package when you come in as a new patient visit, and then also we take them regularly after as your maintenance visits to make sure there's no cavities going on in between the teeth. The other kind of x-ray is what we mentioned before, is what we call a panoramic x-ray. It gives, as the name kind of describes, a panoramic view of it actually shows us the jaw, your jawbone, and all the teeth in our mouth. So that x-ray is typically taken in younger children and also could be in adults as well too, but most useful in cases to evaluate how the teeth are going in young children, because they have their what we call primary teeth, which are baby teeth, and then they will have their developing teeth to make sure they are all developing well. There are no anomalies going on, there's no problems going on. And then also we can use that panoramic x-ray to see wisdom teeth as well too. If somebody has an emergency with the wisdom tooth or they're having pain, your dentist will take that x-ray to evaluate the positioning of the teeth. So that x-ray actually gives us a lot of information where the nerve of the tooth, the nerve lies in our lower jaw, and where your wisdom teeth are positioned. So those are some kind of dental x-rays. Other kind of x-rays we take is for more of orthodontic purposes. And those are x-rays we take from the side, and some of, we call them occlusal view. So those are some of the x-rays we take for orthodontic purposes. Another very commonly asked question is, are dental x-rays safe? Yes, dental x-rays are safe. As dentists, we are not taking x-rays, a patient is not coming every day for x-ray. On the other hand, also the dental x-rays are, especially nowadays, since we have converted to digital x-rays, which most of the dentists, at least in the United States, are taking digital x-rays. So because of digitalization, the frequency and the radiation amount has decreased, even cut down a lot from non-digital x-rays. So there's no need to worry about regarding the safety of the dental x-rays, because of very, very minimal exposure. Think of this way, when we are walking out in the sun and we are using our electronics, our phones and our microwaves, those are actually emitting a lot more radiation compared to what even your full mouth x-rays will emit. So no need to worry about it now. I completely understand that it's a concern since it's a radiation, but it's a very, 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 very low dose of radiation that actually we, all human beings in today's world, get exposed to a lot more than that on actually daily basis. Even actually some of the foods, eating a banana and certain other things, walking out in the sun and, in the saunas and heating beds and all that emit actually more radiation. So these dental x-rays nowadays are very, very safe. So no need to worry about that. We want to make sure that we do those x-rays periodically so we can keep you out of developing any conditions or any infections which are a lot more harmful. So dental x-rays are safe. Another question I do get asked is, can dental x-rays show periodontal disease? So dental x-rays, yes, show certain signs of periodontal disease. So what we are looking for on the x-rays is your bone loss. So when somebody has a periodontal disease, it's accompanied by bone loss. So the only way to see that bone loss is x-ray. So when your dentist does your examination, we pick up certain things from your mouth when we are doing a clinical examination, which show us that these are the signs and symptoms of periodontal disease, but also x-rays when we see the bone loss. And also another terminology, what we call is periodontal ligament. Actually, that's the ligament which holds a tooth inside the bone. We can see some of the signs from there as well too. So yes, dental x-rays will give us information on the periodontal disease. I hope I was able to answer your questions about dental x-rays. If you have any other questions, we are happy to help you answer your questions. Give us a call at 603-926-8827 and we will be happy to answer your questions. Or you can also reach us at our website, www.smilesbythecnh.com. Go ahead, go to the website and you can send us an email and we will be happy to get back to you and help you with any of your questions.